Hello everyone, welcome to Medit World. Myself Dr. Ayush Gupta. Today I will be covering the full subject of anesthesia rapid fire. This video will be uploaded in 4 parts, part 1, 2, 3 and 4. Let's start with the first part where I am going to cover the introduction to anesthesia. First we are going to start with ASA grading. ASA stands for American Society for Anesthesiologists. The grade 1 is for normal healthy patients. The grade 2 is for patients with mild systemic disease. Grade 3 is for patients with severe systemic disease. Grade 4 is for patients with severe systemic disease with constant threat to life. Grade 5 is moribund patient not expected to survive without surgery. And grade 6 is for brain dead patients for cadaveric donation. For example, a patient with a blood pressure of 160 by 110 mm of Hg will be categorized as ASA grade 3, and a patient with multiple organ failure will be categorized as grade 4. Before giving anesthesia, we give certain pre-medications to the patient, which includes, first, for treating anxiety of the patient, we give anti-anxiety drugs like benzodiazepines. We have to put a laryngeal mask airway in the patients, so we don't want patients to salivate more. Therefore, we give anti-sialocox, which are atropine and glycopyrrolate. Which are anticholinergics. We don't want post-operative nausea and vomiting, therefore we give antiemetics like ondansetron, which is a 5-HT3 blocker, or steroids like dexamethasone. To counter acidity, we give PPIs, for example, pantoprazole, rabeprazole, and we can give H2 blockers like ranitidine, cimetidine. For pain management, we give opioids. Next, we are going to see about the cannula sizes. There is 14 gauge, 16 gauge, 18 gauge, 20 gauge, 22 gauge, 24 gauge and 26 gauge cannula. The colors are orange, grey, green, pink, blue, yellow, purple respectively. The flow rates are 270 ml per minute, 236 ml per minute, 103 ml per minute, 67 ml per minute, 31 ml per minute and 13 ml per minute. The flow rate is not very important for NEET, but it could be asked in Inicet. The biggest cannula is of 14 gauge size and the smallest cannula is for 26 gauge size. In pediatric patients, we use 24 gauge and 26 gauge cannula. In trauma or burn patients, we use the widest bore cannula possible, which is 14 gauge, but it is not commonly available. Therefore, we can use 16 gauge, which is grey in color. Next, we are going to see about the types of anesthesia. There are two types of anesthesia: general anesthesia and regional anesthesia. The regional anesthesia is further subdivided into central neuralgial block, and peripheral nerve block. The, cent- the central neuraxial block is further subdivided into three types, which is spinal anesthesia, epidural anesthesia, and caudal anesthesia. The fasting guidelines in anesthesia are for clear liquids, it's 2 hours. For breast milk, it's 4 hours. For cow's milk, formula milk, or light meal is 6 hours. And for full fatty meal, it's 8 hours. What is the Goodell's staging for anesthesia? The stage 1 is stage of anesthesia. The stage 2 is stage of excitement. The stage 3 is stage of surgical anesthesia. Here, the stage 1 of anesthesia is only for pain relief. The stage includes stage of medullary paralysis. We only go till stage 3. The drugs used in anesthesia are general anesthetics, local anesthetics, and skeletal muscle relaxants. The general anesthetics are of two types: inducing drugs and drugs used for maintenance. The inducing drugs are generally IV, while the maintenance drugs are generally given by inhalational route. What are the contraindications for central neuraxial block? The first contraindication is if the patient refuses. The second contraindication is platelet count less than 75,000. The third contraindication is coagulopathy INR more than 1.5. The fourth contraindication is infection on the site of puncture. The fifth contraindication is raised intracranial pressure. The sixth contraindication is uncorrected hypotension. What are the layers pierced in spinal anesthesia? The first layer is skin, then comes the subcutaneous tissue, then comes the supraspinous ligament, then comes the interspinous ligament, After that, ligamentum flavum, then epidural space, then dura mater, then arachnoid matter, a very important question comes from here, that arachnoid matter is last structure to be pierced in spinal anesthesia. If someone asks you what are the layers pierced in lumbar puncture, the sequence will be the same. For the layers pierced in epidural anesthesia, the first layer comes, which is the skin, followed by subcutaneous tissue, followed by supraspinous ligament, followed by interspinous ligament, followed by ligamentum flavum, and then comes the epidural space. The ligamentum flavum is the last structure to be pierced before giving epidural anesthesia. The next topic is Decare surgery. Here I will be covering the important points regarding the Decare surgery. The IV induction of choice in Decare surgery is propofol. The opioid of choice in Decare surgery is remifentanil, because it is very short acting. The muscle relaxant of choice is rocuronium and sugammadex combination. For airway management, we use laryngeal mask airways. The inhalational agent of choice is sevoflurane. For total intravenous anesthesia, we use propofol. A very important question which was asked in Inicet was that which score is used for post-operative nausea and vomiting. The answer to this question was Apfel score. There is another score which is known as Aldred score. It is used for discharging a patient or we can say recovery of post-op anesthesia. The maximum score is 10 and we require more than equal to 9 for discharging the patient. Next we are going to see about the Malumbutti classification. It is used to assess the airway clarity. In class 1, we can see the hard palate, the soft palate, the tip of uvula, in Malumbutti class 2, we can see the hard palate plus soft palate plus only the base of uvula. In Malumbutti class 3, we can see the hard palate and the soft palate only. In Malumbutti class 4, we can see only the hard palate. There is one another class of Malumbutti which is grade 0, in which we can see the epiglottis also. Along with the grade 1. The next scoring system is Cormac lehan grading system. It is important only for Inicet. In grade 1 of Cormac lehan, we can see the complete glottic opening. In grade 2 of Cormac lehan, we can see only the posterior part of glottis. In grade 3, we can see only the epiglottis. And in grade 4, no part of airways seen. For pre-anesthetic audits, this topic is very important regarding antihypertensives, the ACE inhibitors and ARBs are omitted on the day of surgery. Rest all are continued. For oral hypoglycemic agents and insulin, the oral hypoglycemic agents and insulin are omitted on the day of surgery. If the insulin is very necessary to be given, then for type 1 diabetes mellitus, we can give half the dose of insulin, and for type 2 diabetes mellitus, we can give 1/3 the dose of insulin. For antipsychotic medications, all are continued except lithium, which is omitted 48 hours prior to the surgery, and MAO inhibitors or tricyclic antidepressants are omitted 3 weeks before the surgery. All the thyroid medications are continued. The anti-tubercular therapy is continued, but the liver function test of the patient is done. Steroids and aspirin can be continued on the day of surgery. For anticoagulants, clopidogrel is stopped 7 days prior to the surgery. Warfarin is stopped 5 days prior to the surgery. Low molecular weight heparin is stopped 12 hours prior to the surgery for OD dose and 48 hours prior to the surgery for BD dose. The unfractionated heparin is stopped 4 hours prior to the surgery. This was all for the first part. Please subscribe for second part. Thank you.